One of the most commonly asked questions when it comes to hiatus hernia is, how do I know if I have a hiatus hernia? The key thing to understand is firstly know what exactly is a hiatus hernia. In this image, I'm showing you two common types of hiatus hernias. Generally speaking, a lot of individuals who have got a hiatus hernia would have something which is a mixture of both. But for the sake of understanding, this hiatus hernia is called the sliding hiatus hernia, which is more common of the two. And in sliding hiatus hernia, there is a gap in the muscle and a part of the stomach goes up into the chest. Whereas in a rolling hiatus hernia, which is the other kind of hernia, it's also called a paraesophageal hernia, the gap in the muscle causes for the stomach to just roll up into the chest, whereas the point where the food pipe joins the stomach remains below the diaphragm or the gap in the muscle. And therein lies the difference in how they present. Sliding hiatus hernias present as reflux, which means heartburn, acid coming up into the mouth, especially when an individual lies down. Regurgitation, which means, food and liquid coming up into the mouth. Even sensations of choking and coughing are more commonly seen in sliding hiatus hernias. Whereas rolling hiatus hernias, individuals rarely present with reflux or heartburn. They actually present with significant chest pain or even gurgling sounds in the chest. They can also present with food occasionally getting stuck in the esophagus, especially when they have taken a big chunk of meat or bread. And also sometimes that rolling hiatus hernia can present with anemia, which is low blood iron, because there is an ulcer that develops inside the stomach that has gone into the chest, and that creates a wound or an ulcer in the stomach which keeps bleeding, and that leads to anemia or low iron levels. So I hope this explains how these two different types of hernias present, and these are both hiatus hernias, and broadly speaking they come under the category of what we call as diaphragmatic weakness. But more specifically, the hiatus hernia can present with different types of symptoms based on the type of hernia that an individual has got. I hope this video was useful. If you did find it useful, give it a thumbs up and subscribe to my channel for further educational videos of this nature.